Now we'll talk about another way of treatment of accumulation of pus. That's abscesses. All right. So this is what usually abbreviated as what I and D. Okay. That's incision and drainage. Okay, for pus treatment. Okay, incision and drainage just have to do it. Here you use ultrasound to just confirm that it's actually what just pus accumulation. Then you incise, then you drain. Okay, that's as well. So I and D. Right, so it's a common surgical procedure, and is used to cause pus collections such as abscesses. Okay. So steps of incision and drainage include: you have to prepare, confirm the diagnosis, know the type of infection that is there, obtain consent and explain everything to the patient, and they have to agree with you. Clean the area with antiseptics. Okay. All right. So local anesthesia can be used if you feel like there will be so much pain. So things like lidocaine. Okay. So incision, a small cut is made over the most fluctuant part, the softest part of the abscess. So the incision should be adequate to allow drainage but minimize tissue damage. So drainage, now the pus is now expressed manually with gentle pressure. Push it little. So irrigation, the cavity may be washed with all those normal saline to remove the debris. You can see the normal saline being poured in. Okay. So this, okay, that's what we got. So sometimes antiseptics or antibiotic solution can be used if you feel like there's a risk of infections coming in. So packing and drainage and drain placement. So a gauze packing or a small drainage may be inserted just to keep the cavity open. Okay, because you don't want to close immediately, because the pus could actually form again. So you want to prevent premature closure and reaccumulation of pus. So after care, you dress the wound good, analgesics to relieve the pain, antibiotics to relieve infections. The patient should be advised on all those hygiene and follow up. So uses for localized abscess, and if there's failure of, maybe you have tried treating the patient with drugs and it failed. Okay, the issue is getting worse. All right. So you shouldn't use it for deep abscesses or if a patient has bleeding disorders, because incision, you wound a lot of blood vessels, so you don't want to tilt these patients into losing blood.